Hello everyone. Today we will be talking about coronavirus, which is commonly known as COVID-19. Coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus. So please take note, newly discovered coronavirus, yeah? Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. World Health Organization will continue to provide updated information as soon as clinical findings become available. So what are the symptoms that a patient that has COVID-19 that will present with? So people may be sick with the virus for 1 to 14 days before developing symptoms. The most common symptoms of coronavirus disease COVID-19 are fever, which is present in 99% of the patients, tiredness, and dry cough. Most people, about 80%, recover from the disease without needing special treatment. More rarely, the disease can be serious and even fatal. Older people and people with other medical conditions such as asthma, diabetes, or heart disease may be more vulnerable to becoming severely ill. So people may experience cough, fever, tiredness, difficulty in breathing in severe cases. So how do you prevent coronavirus? So you do the 5. 1. Hands, elbow, 2 elbow, 3 face, 4 space, 5 home. So hands, wash them often. Elbow, cough into it. Face, don't touch it. Space, keep a safe distance. Home, stay home if you can. So what is the treatment of coronavirus? There is no specific medicine to prevent or treat coronavirus disease, COVID-19. People may need supportive care to help them breathe. Self-care. If you have mild symptoms, stay at home until you have recovered. You can relieve your symptoms if you rest and sleep. Keep warm, drink plenty of liquids, use a room humidifier or take a hot shower to help ease a sore throat and cough. If you want to learn more, you can go onto this website who.int. So what is the medical treatment? If you develop a fever, cough, and have difficulty breathing, promptly seek medical care. Call in advance and tell your health provider of any recent travel or recent contact with travelers. And then even about medical treatment, you can learn more on who.int. So as of today, novel coronavirus map. So there's 794,066 confirmed cases, 38,413 reported deaths, and 164,338 have recovered. So as of 31st March, US has 164,000 confirmed cases with 3,170 deaths, in which 5,644 have recovered. In Italy, we have 101,739 cases with 11,591 deaths, where 14,620 have recovered. In Spain, we have 94,000. In China, we have 81,000. So these are the top countries with coronavirus confirmed cases. Okay, so if you have noticed, this was basic coronavirus information. There will be another video that will be uploaded soon that will be more detailed. If you are interested in more details, please subscribe, like, comment. Thank you.